Welcome to this educational session on the Minimal Lift program. I'm Cassidy DiDiana, Occupational Health Coordinator with the Occupational Health Clinics for Ontario Workers.
And I'm Trevor Schell, Ergonomist with the Occupational Health Clinics for Ontario Workers, and we'll be your narrators today.
This presentation will examine the following principles: patient handling, policies and procedures, mechanics of the spine, causes of back problems, assessment of risk factors, the 5 P's for safe lift and transfers, explanation of the decals, performing repositioning, performing transfers, and performing lifts.
The overall objective of the Minimal Lift program is to empower healthcare workers with the necessary knowledge and assessment skills to consistently choose the most appropriate and safe transfer or lift technique suitable for their patients. The program will also help healthcare workers perform repositioning, transferring, lifting, and all patient handling procedures in a safe manner. Why incorporate a Minimal Lift program in your workplace? Occupational back injuries are a serious problem worldwide, accounting for considerable morbidity and elevated cost. Workers' compensation and other insurance data indicate that musculoskeletal injuries are the major source of work-related disability among healthcare workers. Research has shown that patient lifts and transfers were found to be the most common cause of reported back injury among healthcare workers.
In Winnipeg, Manitoba, they've had proven success with the Minimal Lift program. A Minimal Lift program was introduced to healthcare staff workers in a healthcare center. The purchase of patient lifting devices for all wards led to a significant reduction in the frequency and severity of musculoskeletal injuries. In the surgical unit alone, the number of hours of lost time due to injuries declined from 13,000 in 1999 to 4,000 in 2002. A similar initiative was implemented in 2002 in Sudbury at an acute care hospital within an inpatient unit. A no manual lift education program was developed for the healthcare staff. In less than a year, the number of full-time staff equivalents that were off work due to patient lifting related injuries declined from 9 to 2 people. A policy should be developed to show the employer's commitment to providing a safe and healthy work environment for all staff and patients by implementing safe and healthy work practices during patient transferring, lifting, and repositioning procedures. The policy should address the roles and responsibilities of all workplace parties.
The employer has several responsibilities under the program. They are required to provide equipment, necessary resources, and staff training, to maintain the Minimal Lift program through quality improvement, to ensure that all staff use mechanical patient lifting equipment and other approved patient handling devices, and to ensure that the program is annually evaluated and updated. The supervisors are responsible to enforce the program through regular monitoring strategies, to conduct accident and incident investigations, and to report all findings of these investigations through the established incident reporting protocol, to ensure that all staff are trained in the use of patient handling equipment, to ensure that all new staff receive general and site-specific orientation to the policy and the program, and to maintain equipment assigned to their department. Supervisors are also responsible for conducting pre-start inspections, to include the auditing of staff practice in the monthly planned inspections and to report on these findings to senior management, to ensure that all new clients have a mobility assessment within 24 hours of admission, and to determine the transfer, lift, and repositioning technique and equipment which is required, to ensure adequate communication and documentation processes, to take every reasonable precaution for the protection of the staff and of the clients, and to acquaint staff with policy and supporting programs through orientation and regular educational sessions.
Responsibilities of the employee: comply with policy and procedures at all times, participate in regular training as established by the organization, and maintain your continuing education record, record any unsafe acts, hazards, equipment problems, change in patient mobility status, or any other untoward issue immediately to the supervisor or delegate, report any incidents, accidents, and near misses to the supervisor immediately and complete an incident report, and to ensure that all new patients have a documented mobility assessment within 24 hours of admission and determine the lift transfer technique and equipment needs. Definitions. Repositioning. Shifting, adjusting, or changing the patient's position in bed, wheelchair, chair, or other supportive surface. Transfers. Guiding and/or assisting the patient from one surface to another. The patient is able to bear some weight in the legs and/or arms, and/or part of the weight is borne by an assistive device such as a transfer board, walker, or cane. Lift. Any procedure where the patient's entire body weight is borne by someone or something other than the patient, i.e. a mechanical lifting device, for purposes of positioning or moving a person to another surface.
Principles of lifting. It is important to remember the acronym BACK. Keep your back straight, avoid twisting, close to the body, and keep smooth. How to lift properly. Plan ahead before lifting. Lift close to your body. Keep your feet shoulder width apart. Bend your knees and keep your back straight. Tighten your stomach muscles. Lift with your legs, and if you're straining, get help. Repetitive and sustained activities in one direction without movement in the opposite can place uneven stresses on the spine. Uncorrected, these activities lead to increased stress on the discs, which can lead to disc pain.
Performing client transfers with a flexed lumbar spine, which means being bent forward at the waist, can increase the stress on the intervertebral discs of your lower back. Discs are weaker when lifting from this flexed position. As indicated, you want to maintain the spine's neutral curves. Injuries associated with a deviation from a neutral spinal position usually result from repetitive procedures. You can achieve a neutral spinal position by bending your knees and hips. This will help you to use the stronger leg muscles to assist the client in the transfer. It is not possible to obtain a neutral position if the healthcare worker does not bend their knees and hips or is too far away from the client. You also want to avoid twisting. Discs are weaker when lifting is combined with twisting. The outer structure of the intervertebral disc is composed of thousands of overlapping fibers. When we twist, half of these fibers unwind, making the back half as strong as it was when we were standing straight. Twisting while assisting patients with transfers puts great stress on the spinal structures. Uncorrected, this causes the structures surrounding the disc to weaken over time, which puts them at a higher risk for injury. Facet joints on the vertebrae are designed to prevent rotation. If you twist when you lift, these joints become inflamed and sore. The best way to reduce twisting movements is to pivot your feet during a patient transfer. If this is not possible, then you should turn your lead foot in the same direction as the patient transfer. It is important to keep the load close to your body. The joints in your back act like a fulcrum, and the muscles work to counterbalance the weight of the object being lifted. As you can see from this picture, the muscles of your back act to counterbalance the weight of the object and the weight of your upper body. The further an object is from your body, the harder your back muscles will have to work in order to lift the object, which creates stress on your back structures. Therefore, you want to keep the load as close to your body as possible.
Keep smooth. I'm sure that everyone has seen at some point powerlifting on the Olympics. Well, have you ever seen a 40-year-old powerlifter? Probably not, because each time they are lifting the weight, normally in 3 processes, they are subjecting the fluid inside the intervertebral disc to jerky lifting, which forces the fluid against the overlapping fibers, causing them to break and wear down. Most powerlifters end up with long-term back problems as a result. To prevent this, lifting should be a smooth, continuous movement. Also, when you are lifting, make sure you communicate with a partner throughout every aspect of the lift to avoid any uneasy jerking of the spine. Also, remember to keep the load close to the body. Assessment. Completing an assessment before a transfer or a lift is important because it aids to determine the risk of injury, promotes continuity of care, helps you to be prepared for possible risks, and helps to minimize the risk of injury for the healthcare worker and the client. An assessment should be done prior to every transfer or lift, upon admission to the facility, after the patient has become familiar and adjusted to the facility, and whenever there are changes in the patient's status. It is also important to remember that an ongoing assessment should be done on a regular basis.
We will now discuss the 5 P's of safe lifts and transfers. They are plan, prepare, position, protect, and prevent injuries. As part of plan, you want to assess the patient's lift and transfer needs. Refer to the patient data profile or care plan and the bedside signage. Reassess the patient every time a lift or transfer is required. Plan the task, look for the hazards, and consider environmental factors. Also, consider whether the patient's status may affect the transfer, such as whether or not they have been sedated.
Communication is an important aspect to consider when planning. Difficulty in communication can result in the patient's inability or unwillingness to cooperate and assist with a healthcare worker during a lift transfer procedure. Relevant assessments include the following: speech, vision, hearing, understanding, and language barrier. Older patients with poor short-term memory may have difficulty following instructions. Therefore, it is important to use short, precise instructions that are provided one at a time. By limiting the number of choices given to a patient, it will reduce the risk of them becoming confused or frustrated. It is important to assess the following before performing a lift: memory, judgment, concentration, and decision-making skills. Before performing a lift or transfer with a patient, the following must first be taken into consideration. It is important to understand the patient's diagnosis in order to assess how these symptoms may affect his or her ability with the lift or transfer procedure. Knowing a patient's ability to ambulate will assist the healthcare worker to choose the best lift transfer procedure. Assessment of a patient's pain level is also important in order for the patient to handle the activity involved in a lift or transfer. By knowing the type of medication a patient is receiving, it will ensure that the healthcare worker is aware of the patient's potential limitations. Energy level is also important to assess, as it will provide the healthcare worker the ability to make choices best suited for the patient's physical state. Time of day can influence the ability of a patient to assist with the lift or transfer. For example, patients with osteoarthritic joints may experience increased joint pain in the morning and require more assistance during the transfers that are performed in the morning than later on during the day.
As part of plan, you also want to assess the patient's physical condition. It is important to conduct a screening assessment of the patient's physical function in order to determine how much the patient can assist with the lift or the transfer. Assessment of the following should be conducted: sensation, skin, weight and height, range of motion, strength, balance and coordination, body awareness, depth perception, and weakness. It does not have to be a comprehensive assessment, but rather a screening tool to assist healthcare workers in determining the most appropriate type of transfer or lift. It is also important to assess a patient's state of mind. The following factors may have an effect on a patient's ability to safely complete a transfer. These may include a patient who is combative, erratic, uncooperative, depressed, agitated, or confused. As a healthcare worker, it is essential that you assess not only the dangers to your patients, but the dangers to yourself as well. Some of the things that should be assessed include your ability to perform the task, your knowledge and experience, your visual and hearing abilities, your mindset, your approach, your height, your level of fitness, your level of stress, any time constraints you are under, whether you are working shift work, your level of fatigue, your lifting frequency, the level of staffing, and your size relative to the client. A quick fact: a significant height difference between two healthcare workers can affect the performance and safety of a transfer or lift. The taller person should be situated in the back during this procedure.
In order to perform the transfer or lift safely and effectively, a healthcare worker must assess for environmental risk factors. For room size, such things as confined spaces such as a bathroom may prevent the use of accepted body mechanics and limit the use of assistive devices. For equipment, medical devices such as catheters or intravenous tubing can increase the risk of injury to the client or caregiver during the transfer. For the task to be performed, if the healthcare provider is unsure of how to use the equipment, they should ensure that they have proper training and education. Also, try to position yourself and the client so you're in as neutral posture as much as possible. Finally, be aware of any hazards that may be present, such as magazines and bedside clutter, slippery or wet floors, poor lighting, and distractions such as noise. When it comes to preparing your environment, you should look at some of the following principles. Communicate the type of lift or transfer and tasks to be completed to the patient and the assistant. Clear the path of obstacles so that the destination should be as close as possible. Gather all the equipment required prior to transferring. Ensure the patient is wearing appropriate clothing, footwear, splints, and that the catheters and IV poles are secured. Remember, the healthcare worker can select a transfer or lift technique that requires more assistance than indicated on the bedside decal or patient care plan. Bottom line, ask for help when you need it.
Preparation is required in 5 areas: the equipment, the environment, the healthcare worker, the patient, and with communication. With respect to equipment, inspect all equipment to ensure that it is operating properly. For example, ensure that the batteries are charged. Report any faulty equipment immediately. Label or tag it as necessary. Position equipment correctly. For example, place the wheelchair, commode chair, or chair parallel to the bed or at a slight angle close to the bed. Apply or remove slings, splints, or braces as per the policies and procedures and/or the manufacturer's instructions. Set the bed at the optimum height for both the healthcare worker and the patient. Lock all wheels on the equipment unless required. Ensure that the bed rails are lowered as needed. Remove the arm and leg rests unless required. You must also prepare the environment. By ensuring that the environment is cleared of hazards, the transfer or lift procedure should proceed smoothly. You want to ensure that you clear the area of obstacles, that you ensure that furniture is arranged for ease of transfer, and that there are no spills on the floor. You want to assess the area to ensure proper lighting and minimize noise to avoid distractions when preparing the patient for transfer.
When preparing for a lift or transfer procedure, the healthcare worker should set up the environment in order to reduce hazards, inform the client of what is to happen and get permission to proceed, do a mini assessment to ensure that the chosen procedure is still appropriate, position yourself correctly as will help the patient feel safe and enable them to hear and see you more efficiently, explain clearly to the patient what you are doing, communicate throughout the lift or transfer procedure, tighten your abdominal and buttock muscles using the leg muscles in order to protect your spine from injury, and avoid twisting by using proper body mechanics. Never grasp the patient under the armpits, as it can result in the risk of a shoulder injury. Be prepared for the unexpected. Pause during each step of the procedure for the safety of the patient and yourself. Postpone the task if the client is aggressive, resistive, or uncooperative. Bottom line, do not risk injury to yourself or the patient. Use good judgment and get assistance if needed. When preparing the patient, ensure that the patient is wearing proper clothing and non-slip footwear. Have the patient assist by pushing off the seated surface. To avoid neck injury, do not let the client place their arms around your neck. Ask the patient to place his or her hands on your forearms, shoulders, hips, or piece of equipment. Ensure that equipment such as IV tubes and poles, urine bags, and safety belts are positioned so they do not interfere with the lift and preserve the patient's dignity. When preparing for a lift, make sure that you communicate. Talk to your partner and plan the procedure. Decide who will be the lead and who will assist. Always explain to the patient what you are going to do and how he or she must help. Give short, simple, clear instructions to each other and the patient, and communicate during the lifting by counting.
The position of the healthcare worker and the patient are equally as important. The healthcare worker must maintain good posture, which includes a wide stance, knees and elbows bent, and positioning themselves close to the patient. For the patient, their feet should point in the direction of the transfer. The healthcare worker may need to block the patient's knees or feet to prevent slipping or buckling of their knees. Each transfer or lift should allow the patient to be as independent and comfortable as possible. They should also be safe for the patient and for the healthcare worker. You want to minimize the load on the low back of the healthcare worker. The next P is protect. Use assistance whenever needed. Communicate the lift or transfer throughout the procedure to your assistant and patient. Use proper body postures during all procedures. Expect the unexpected by anticipating what could go wrong and how to intervene if it does.
The final P is prevention. Strive for a minimal lift environment. The healthcare worker only helps the patient to transfer. If more assistance is required, a mechanical lifting device is to be used. After every transfer, evaluate the technique and outcome to determine if changes are required to prevent injuries to the patient and healthcare worker. Document in the patient care plan and ensure proper signage is placed over the bed. And exercise and stay in shape.
Regular exercise helps to strengthen your back and abdominal muscles, which in turn will reduce the risk of back injury. Walking is an excellent exercise for the back as it helps to keep the discs nourished. Do something you enjoy. Stretching is an important component of any physical activity. Cold muscles are more likely to be injured. It is important, however, to warm up with a couple minutes of physical activity before you stretch. Muscles can be viewed much like an elastic band. If you took an elastic and placed it in a freezer overnight, it would freeze. Now, if you suddenly pull on the frozen band, it would snap. However, if you took the elastic band and slowly warmed it up first, you would soon be able to stretch it to its regular capabilities. Your muscles are much the same. They are cold and stiff in the morning and need to be warmed up and then stretched gently to avoid injury. Remember, do not lift anything immediately after sitting for an extended period of time. Walk around and loosen up first.
What are decals? They're a set of symbols used to show various lifts and transfers that can be used. As per the minimal lift policy, the assigned staff member completes and documents the assessment using the patient history and assessment record.
Why are the decals used? They are used to let the healthcare worker know which lift or transfer to perform with a particular patient. They help to promote consistency in lifting and are quick to interpret. Where are they located? The decal is placed above the patient's bed and also identified in each patient's data profile and patient care plan.
Independent transfer. After an assessment has been completed and the client is determined to be independent, ensure that this is documented in the patient's chart. An independent transfer should be used when a client is able to mobilize without the risk of injury, and the client is comfortable with the use of mobility aids if they're using them, and performs predictably. Supervised transfer. This technique should be used when the client is able to mobilize but may require verbal or minimal physical cueing, and transfer belts should be used in all cases. Transfer using the transfer belt for one person. This is used to allow the caregiver safe handling of the patient. It should be used when the patient can stand unsupported or weight bear with assistance of one person who will provide less than 40 pounds or 18 kilograms of assistance, when the patient is cooperative and results are predictable, or when the physician orders feather, toe touch, or partial weight bearing. When cleaning the transfer belt, wipe the transfer belt with hospital-approved cleaning solution or 70% alcohol as required. If heavily soiled, send to in-house laundry to be cleaned. Do not send with general linen to central laundry.
Procedure for one-person transfer using the transfer belt. Remove or swing away the footrest from the wheelchair. Stand facing the patient. Place one foot between the patient's feet and the other foot behind you in a wide stance to provide a sturdy base of support. Grasp the transfer belt. Instruct the patient to push off the bed with their hands. Instruct or assist the patient to place both hands on the armrests and to sit slowly in a smooth, controlled motion.
Transfer using a transfer belt with 2 people. This should be used when the patient is unpredictable or uncooperative, when the patient can bear weight on at least one leg, and this technique requires 2 healthcare workers, with the taller of the 2 positioned behind the patient.
Procedure for the 2-person transfer using the transfer belt. In the 2-person transfer, there is a leader and an assistant. The leader conducts the lift in the same manner as for the 1-person transfer. The assistant should stand between the wheelchair and the bed, with one knee on the bed. The assistant should only be assisting with the transfer, guiding the patient and not bearing much of the patient's weight. Together, count 1, 2, 3, stand. On the command stand, use a good posture to shift your weight backwards, bringing the patient forward to assist with weight bearing. Pivot the patient towards the wheelchair and assist them into the chair and perform the same procedures as prior transfers.
A walker transfer should be used when the client can bear weight on at least one leg, needing extra support, and whose upper extremity strength and mobility are adequate. When the physician orders feathered toe touch or partial weight bearing, and at all times a transfer belt must be used.
Procedure for walker transfer. Prepare the environment, prepare the patient, and prepare yourself. Place the walker in front of the patient. Stand on the patient's weaker side, holding the belt at the patient's front and back. Instruct the patient to lean forward and push up off the bed and gain balance before holding onto the walker for support. Instruct the patient to take small steps towards the chair. Then instruct the patient to grab onto the armrest of the wheelchair and slowly lower themselves into the chair. Remove the walker and help the patient wiggle back.
Bed to stretcher transfer using a slide board should be used when the patient is in a supine position and is unable to sit and/or help with the other transfers. The patient is unable or not allowed to move or is unconscious. The surfaces involved in the transfer must be of equal height or can be slightly lower. It requires a minimum of 2 caregivers. Note, a sliding sheet or draw sheet can be used to transfer the patient between bed, stretcher, operating table, and x-ray table. The slide board is cleaned after use with hospital-approved cleaning solution or 70% alcohol.
Procedure for the bed to stretcher transfer using the slide board. Remember, prepare the environment, prepare the patient, prepare yourself. Raise the bed to mid-thigh level. To position the slide board under the patient, first cross the patient's arms across their chest. Roll the patient towards the lead caregiver by grasping the patient's far shoulder and hip or their bent knee. Place the board underneath the patient. Roll the patient back down onto the slide board, repositioning as necessary. Position the stretcher parallel to the bed and ensure that it is locked. The 2 caregivers stand on either side of the bed facing the patient. The leader should stand on the side to which the transfer takes place. Together count 1, 2, 3. Caregivers shift their weight from front to back or from back to front as appropriate, and slide and pull the patient smoothly onto the stretcher, maintaining good body mechanics.
Fit in the sling of a mechanical lift. All transfers using mechanical lift must be done so with the use of a properly sized sling. Slings are identified with a code. The code must be included on the decal located at the bedside. 2 caregivers are required to properly fit and apply a sling.
Slings can accept a patient weight of up to 400 pounds or 180 kilograms. There are several types of slings and should be selected based on the activity of the client, i.e. general use, when left under the patient for long periods of time, or when bathing. When caring for the slings, all slings should be inspected prior to each use. If there is any question concerning the condition of a sling, take it out of service. Slings are not to go to central laundry. You must also consider the following when choosing the correct sling size and fit: the patient height, the patient torso width and girth, and the patient leg width and girth. The sit-stand mechanical lift, or SARA lift, should be used when a client can sit with minimal support at the edge of the bed and is able to bear weight, when the client is able to tolerate the harness under his or her arms with no history of shoulder problems, when the client is able to follow commands consistently and reliably. This requires 2 people to operate and should not be used when the physician orders feather, toe touch, partial, or no weight bearing. Also, do not use it with a hemiplegic arm.
Procedure for the SARA lift. Instruct, or assist, the patient to lean forward to apply the harness. Position the lift in front of the patient and instruct them to place their feet on the footplate. Attach the harness loops to the boom and instruct the patient to grasp the handles and to lean back into the harness. One caregiver will operate the hand control, and the second caregiver will guide the patient as they are being lifted to the bed by holding on to the back of the harness. Tell the patient to continue to hold on to the lift handles. Lower the patient onto the bed or the chair. Guide them into a sitting position.
Total mechanical lifts should be used when the patient is unable to assist with the transfer, confused, agitated, unconscious, uncooperative, or is extremely large. The healthcare provider is required to lift greater than 40 pounds or 18 kilograms. There is a weight restriction of 400 pounds or 180 kilograms. If the patient is higher than this weight, then a bariatric lift should be used. This lift can be used by all patients except those who have arthroplasty or are hemiplegic. There is also a minimum of 2 healthcare workers required to perform the lift. Mechanical lifting devices are designed for surface-to-surface transfers over short distances. They are not to be used for transporting patients. Some general information about the total mechanical lift. Many-man slings are used only for the many-man patient lift. When the patient is being lifted, the wheel brakes on the many-man patient lift are off. Leaving the wheels free to creep when lifting the patient allows the lift to maintain its natural center of gravity so that the patient is not swung off center, reducing the risk of tipping. Once the patient is clear of the bed or chair during the lift boom should be lowered so that the patient is facing the caregiver to stabilize the lift and reassure the patient.
Procedure for transfer from bed to chair using the total mechanical lift. One caregiver should assist the patient to roll towards them, utilizing the log roll. The second caregiver will slide the sling under the patient. Log roll the patient in the opposite direction and pull the sling through to straighten. Roll the patient onto back. Place the leg strap around the patient's legs. Instruct the patient to fold their arms across the chest. Adjust the base of the lift for stability and to accommodate the workspace. One caregiver should remain at the patient's head, and the other should operate the total mechanical lift. Verbally prepare the patient for the move and instruct them to bend their legs. Attach the shoulder straps to the appropriate sling suspension hooks, matching loop size on each strap, and tug on the loops to ensure proper seating. Using the remote hand control on the lift, raise the patient until just clear of the bed. The second caregiver should grasp the patient's legs and guide the patient. Turn the lift in the direction of the chair with the patient's back towards the chair. Move the chair as close as possible to the lift and lock the chair brakes. Position the patient over the chair and lower slowly, using the remote hand control into the chair. The second caregiver will grasp the sling handle at the midline of the patient's back while being lowered, and then guide the patient into the chair. Remove the sling and ask the patient to lean forward to assist in removing.
Repositioning using slide sheets should be used when moving or repositioning a patient in bed who is unable to move themselves independently. When a patient needs to be moved in bed, transferred to a stretcher, or moved in response to an emergency situation, or in moving a client in an emergency situation where the patient has fallen into a confined space or the mechanical lift or other transfer method cannot be employed. Slide sheets are to be hung on hooks in the patient's room after use. They may be spot cleaned with hospital-approved cleaning solution or 70% alcohol as required. Do not send with general linen to central laundry. Regular inspection of the sheets is required and they should be replaced when necessary. Please note, the slide sheet is not left beneath the patient after use if the patient mobilizes in bed and should not be left under the patient if sitting or sleeping in an elevated position, as the patient will slide down the bed. If the slide sheet must be left under the patient, a draw sheet is placed between the patient and the sheet to keep the slide sheet clean. The slide sheet is not to be used to lift patients.
Procedure for repositioning a patient up in bed using a slide sheet. Adjust the height of the bed for the caregiver to a comfortable working level, around mid-thigh height. Place the slide draw sheet under the patient for repositioning in bed. Place the pillow against the head of the bed. Ask the patient to bend their knees and to cross their arms on their chest. At the count of 3, both caregivers, using good body postures, grab the slide sheets and transfer the patient to the desired level in the bed. Do not attempt to move beyond caregiver's base of support. Remove the slide sheet from under the patient if used by grasping the corner at the patient's farthest shoulder, turning the slide sheet under itself as you pull in the direction of the patient's hips.